Hello, this is Dr. Bhojraj from VR Spine, and I'm going to talk about one interesting patient who came to us with difficulty in walking and difficulty in using his hands. And on checking, we realized that he probably has a compression of the spinal cord in the neck. If you look at the MRI, this is the MRI of the neck. This is the brain, and that's the spinal cord coming down. The spinal cord is like an electrical wiring, and the white coating around that is like an insulation of a wiring. If you follow my finger till here, there is insulation. In this particular area, the spinal cord is thinned out and there is no insulation. Then again, as you go down, the insulation reappears. So this is an area with significant cervical cord compression, and this is an area which needs to be decompressed. So we have to make more room for the spinal cord, so the spinal cord gets space again and the electrical activity starting from the brain starts. So we operated on this patient and we did what is called as a cervical decompression from the back side. It's a quick procedure. It takes less than 1 hour, but with gratifying results, because immediately after surgery, we hope and we are certain that the function which he has lost both in the arms and legs will start reappearing, and he'll be able to go back to good functional activity. Thank you.